Hello, everybody. Oh, a message about recording. So if anyone's got any problems with recording, if you can let that be known, that would be helpful. We're going to share some slides, and just to, by way of very brief introduction, I'll just set a little bit of the scene and set a little bit around what we're doing. As Anthony has said, my name's Brent Kilmurray, and I'm the Chief Exec of Tees Esk and Wear Valley's NHS Foundation Trusts in my day job. But I've been asked to pick up the chairmanship of the steering group for the Green Social Prescribing programme for Humber Coast and Vale, and I'm really looking forward to getting into it. And I'm delighted that so many people have been able to join us today to sort of start this journey with us over the coming few years. So I wonder, could you change the slide, please, Anthony? Why are we here today? So this is the start of a brand new and exciting programme, and today we're looking forward to sort of sharing our plans for this work across Humber Coast and Vale. We've been selected as one of only 7 sites across the UK to receive some funding, and that says, I think, a great deal really around the work that's already been going on within the area, within the Humber Coast and Vale area, around both health services and the voluntary sector, and some of the early work that's been happening around social prescribing generally in the patch. They've backed our ambition. As part of the process, we set out our thoughts around how we can move this forward, and the team put together a very strong bid that set out our ambition and captured the energy about how we can build this, and building on those foundations of what's been happening, and get a programme together that will allow us to set out some examples that can be looked at both locally and nationally to extrapolate as much learning as we can. As part of the approach. We'll talk a little bit more about that in a moment. The award for the programme happened in December of 2020, and the actual works fully got underway really only just since April 2021, and Anthony's come on board as the programme manager, and the rest of the team, I'm sure, will have an opportunity to introduce themselves as we go through the session this afternoon. But since then, the team's been doing a lot of hard work, a huge amount of hard work, to go around and to start to build the infrastructure that's going to allow us to get going with this. And we're keen to share some of the thoughts really around where we're headed with it as we go through. We've been working together to build the team. So Anthony and the team are together, as I mentioned, and a key part of their work over the last few weeks, only a few weeks really, has been to get out and listen to those that are already involved in green social prescribing in the area and start to build the network of people that are going to help us to make this a success. And I'm really pleased that so many of you have been able to join us today. This is a partnership project, so that aspect of it is really important. And one of the things that we want to do is to really think about how we can co-create how we roll this out, the what and the how, as we work through with you and other partners as we progress this. You'll hear about some of our early plans. So we obviously had to set some things in motion, and some of that is about how we intend to engage with people. So what can this programme do for health systems locally? Well, as chief exec of a large mental health trust in the area, I fully understand, there are lots of pressures, lots of challenges facing healthcare currently, and most importantly, lots of pressures that are facing our communities. And what we need is a range of different solutions to help us to meet those pressures. The sorts of things that we can do with this programme and the money that we are in receipt of to support this will allow us to test and learn new ways of working and working in partnership with the VCSE and obviously healthcare organisations. We can start to think about how we can change mindsets about meeting some of those challenges. We expect that the Green Social Prescribing programme will help patients waiting for treatment, those that have treatment needs that might be escalating, and certainly those that are looking for other ways in terms of furthering their recovery. And we're going to focus specifically on mental illness and mental health issues. The approach enhances choice for people. It can also alleviate pressure on systems, but also it can inspire people to sort of move forward and to help manage their own care as part of their challenges. This programme's focused particularly on supporting people with mental health problems, as I've mentioned, which we know is obviously growing in the post-pandemic. we know that through some of the forecasting work that my organisation and other organisations are doing, that's only going to increase. We're going to see significantly more people coming forward, looking for help and support to meet those needs. And, you know, both in terms of volumes and acuity, we know that this is an increasing pressure for the system. Could you change the slide, please? So within mental health care, we've become far more attuned over a long period of time, really, of the need not just to see people's symptoms and to work with people just in terms of a set of problems that they present with. And we've started more clearly to sort of work more holistically with people. We know that there are a number of things that people need to support their recovery and well-being and to make them feel better. And to do that, you may have probably heard of things that are known as the chime principles. I'm just going to quickly run through them. So the chimes are, you know, one of those words that all the letters mean something on. Can't think of the word for that at the moment. Actually, there probably should be one of those for that. But the chime principles relate to connectedness, hope and optimism, identity, meaning and purpose, and empowerment. And these are all aspects, I think, that green social prescribing can start to offer. But we're proposing that we're going to encourage this, you know, much more so in the natural environment, making the most of the beautiful assets that we've got within Humber Coast and Vale, using green spaces in nature. I know that for my own well-being, how satisfying it is to work in a garden or to go out walking with friends. And during COVID, I know that especially during wave one of the saving graces for a lot of people was the ability to get out and about and enjoy some exercise, fresh air in the environment. Some people may not be as fortunate to have the opportunities that I do, or maybe you do, or the motivation, or the connections, or the resources. And the activities we're talking about will be for them, will be for everybody. And we can open that up in a way that people can find far more accessible and can support them. That sense of connectedness and purpose is also for me, really a key part of driving well-being. And I hope that for many people, that they'll feel this, and this process will help to extend their networks of friends and colleagues as they go through the work that we're doing. We just change the slide, please, Anthony. Just a few words on the role of the steering group. It's a national test and learn site that we're part of now. So this is a nationally supported program with an emphasis on drawing out learning and obviously implementing key new ways of working, getting those delivered and getting that evaluation in place. And we'll hear more from Hannah about that shortly. And the steering group's role is to oversee this and to think about how we can focus on the outcomes. And we've got a particular view really about how view and sight on how we can look to make this a more sustainable approach for the future and get it embedded in ways of working. Where do we want to be in the future? What we want to do is we want to see green social prescribing well established and a key part of our pathways across Humber Coast and Vale. It'll need to be supported by the right infrastructure, and clearly there'll need to be investment, and that investment needs to be in the mental health support that goes with this, but also into the green and blue spaces that are going to be a key part of the offer that we want to put together for people, and the way that we're going to engage people to unlock better mental health for people and unlock their potential. I'm looking forward to chairing this steering group and getting going. It still feels very early days for us. I know that there's a great sense of optimism, and the number of people that have attended today tells me that we're onto something good here. I want to just wish the team the best of luck with this, and I'm looking forward to getting going. So thank you very much. That's all from me. I think I'm handing over now to Gary.
Thank you, Brent. Yeah, so I'm Gary Sanchez. I'm the VCSE Programme Director at Humber Coast and Vale Health and Care Partnership, which is a very long title. And the Humber Coast and Vale Health and Care Partnership is the integrated care system for the area, and the Green Social Prescribing Programme sits, as mentioned previously by Anthony, with Humber Coast and Vale Health and Care Partnership, and specifically with the VCSE Leadership Programme that I'm the Director of. For some people, the integrated care system, you'll have heard of it. For others, not so much. So if we just go to the next slide, please. I've just put up a quick few lines in terms of what the integrated care system is, what Humber Coast and Vale Health and Care Partnership is, and there's a link to a video which will be shared, and obviously you'll have the slides afterwards as well, which just gives a bit of an explainer as to what an integrated care system is. But the bullet points kind of just explain a little bit about what it is that we're trying to do. So it's about new partnerships, about joint working. It's about different sectors coming together to reduce health inequalities. And I think one of the reasons to put this slide up and the kind of new way of working in this new NHS body that's coming into being is the Green Social Prescribing Programme will do all of this, what is on the slide. It's about creating those new partnerships. It's about looking at health inequalities and how do we work differently and jointly to overcome some of those. And like I say, I think the Green Social Prescribing, once we get into the programme, will do exactly this, and it sits really nicely with the Humber Coast and Vale Health and Care Partnership. I mentioned that it sits specifically with the VCSE Leadership Group, and if we can flick onto the next slide, please. The role of the leadership group effectively is to connect the voluntary and community sector up with the health and care system in a nutshell. So we've got many people on the call today that will be from different types of organisations working in the community. Some people on the call may be from the health system, and it's about making the most of those collaborations. And again, the Green Social Prescribing Programme can do all of what is on the screen. The vision for the VCSE Leadership Group is on the screen, and this is what we're kind of working to. And the programme, I've highlighted a couple of words, and I think these are the bits that the programme can really help us with. So it's about influencing decision makers, pathways, and again, I think if we test different approaches through the Green Social Prescribing Programme, connect to different partnerships and create new relationships, then actually we can influence what's going on in the future from an evidence-based point of view. It's about collaboration, as I mentioned, and again, there will be new partnerships formed that already have been formed in the early stages in the last few weeks with the team coming into post, but certainly many more partnerships to be formed moving forwards and relationships to drive this programme forward. It's about enhancing the role of the VCSE sector, so all of your organisations that are out there working in the community, it's about showcasing the contribution you have towards people's health and care. And again, through this programme, it's about connecting that to the green and blue spaces, get my words out, across Humber Coast and Vale. And I mentioned that the integrated care system is a new body that's coming into being, and programs like this help us to make sure that we're part of that transformation and we can put the best case forward for the voluntary and community sector to be a key strategic partner around that table. If we can move on to the next slide. This next slide is really just to show kind of the connectivity from a VCSE leadership point of view, but again, I see the Green Social Prescribing Programme pretty much running throughout this as well. And at the top there, you've got the neighbourhood level, you've got the community level, working with people. And again, a lot of your organisations will be working on the ground in the communities across Humber Coast and Vale, supporting people with their health and care needs. That connects for us at a place level. So we've got 6 places across Humber Coast and Vale, 6 networks of voluntary and community organisations coming together and working together and sharing learning. And again, this Green Social Prescribing Programme, we will have different ways of working taking place in all of the different areas of Humber Coast and Vale, and it'll be fantastic in a few months' time to be able to pick through that and have a look at what's working where well, and can that be shared in other areas and find out what's happening in the other areas of Humber Coast and Vale. And ultimately, that all connects up at a system level as well. So colleagues from the Humber Coast and Vale Health and Care Partnership, from different NHS bodies, will all be kind of looking into the Green and Blue Social Prescribing Programme and seeing the value that it can have to patients' health and care needs. And there'll be a whole heap of learning that we will take from that. And this isn't a top-down, bottom-up approach. Actually, it's about sharing things across and sideways as well, and really learning from what's taking place across the system. And finally, from me, I've mentioned about the place, and we've got 6 places across Humber Coast and Vale, all of which are represented at the VCSE leadership group. But just to note, East Riding of Yorkshire is represented by Smile Foundation, and it's been fantastic that they've taken the lead for the Green and Blue Social Prescribing programme. Obviously put a fantastic team in place that have been in post now a couple of months, and have really driven this programme forward, and are kind of holding the ring on that programme as well. So it's fantastic, and thank you for them for taking that lead. And I think we're about to hear the progress that's been made to date and what the future holds for Green and Blue Social Prescribing. Over to you, Anthony.
Brilliant. Thanks, Gary. So yeah, so my name is Anthony Hurd, as I said, Programme Manager for Green Social Prescribing. What I want to do over the next few slides is to give you an overview of the programme, but also, as Gary says, the progress we've made over the last 9 weeks today that we've been in post, and our plans going forward. So can I have the next slide? So as Brent mentioned, we're one of 7 test and learn sites across England, which is looking at how to embed green social prescribing into communities. What we're really looking to do is improve mental health outcomes, reduce health inequalities, reduce demand on the health and social care systems, and develop best practice in making green social activities more resilient. Gary's just mentioned that I work for Hull and East Yorkshire Smile Foundation, and we're the lead provider delivering the programme on behalf of Humber Coast and Vale Health and Care Partnership. And we're overseen by the steering group, which Brent chairs. But that is composed of 11 individuals, which represent the public health, mental health, nature, active and social prescribing sectors, alongside lived experience. So can I have the next slide, please? This is just to show you who we have on our steering group. So all the different organisations which are sitting there and helping us through this next 2 years. Next slide. So in terms of what we're looking to achieve here in Humber Coast and Vale, our ambition is that no one feels alone whilst waiting for mental health interventions, and that we utilise community-based green and blue assets to support recovery and improve health and well-being amongst individuals. So we are working across many sectors to achieve this, and we aim to support our mental health and social prescribing services by working with those existing networks and ensuring that there is easy access to green social prescribing community. We're looking to, as a test and learn site, collate and gather data on individual and wider community impacts of green social prescribing, again, working across sectors. And we'll also be following a clinical cohort through a green social prescribing journey. So Hannah will talk more about this and our work plan with that. And we're looking to develop a shared common outcomes framework to use across all of our 6 places. Obviously, the voluntary community and social enterprise sector is key to delivering green social prescribing. And we're looking to increase sustainability by growing our own. So there will be grant funding through the programme, looking to support those leading initiatives to thrive, but also support new and upcoming interventions. And ultimately, we want to help those in need of mental health support by embedding green social prescribing in all 6 of our places as an integrated part of our healthcare system, and support and champion a diverse range of green social prescribing so that it caters for a wide user base. Can I have the next slide, please? Excellent. So what we just wanted to do is if you could put in the chat your sort of favorite and go-to green and or blue space. So just as a kind of starter, there's my allotment, one of my favorite green spaces to go to, and then South Landing in Flamborough, absolutely fantastic location, and that view as you walk down the road and the sea opens up. So yeah, please do put in the chat kind of your favorite places, be they urban, landscape scale, but it'll be a really good opportunity to get a flavour of what we have across the region. Next slide. So, you know, where are we starting from with this programme? The first thing to say is that the Humber Coast and Vale region is absolutely rich in outdoor space in which to engage. So, this is one slide and a really small snapshot, but we've got the Flamborough Cliffs, we've got the Yorkshire Wolds, there's Hessel Foreshores there, Pickering Park in Hull, North Bay Scarborough, Rawcliffe Meadows in York, Blacktoft Sands, Northcliffe Woods and Kirkham Abbey. So we've got a really rich environment in which to engage and push this programme forward. Next slide. So I've got another sort of couple of questions for you. What we want to do is get a snapshot of people's current thinking with regards to green social prescribing. So if you can put it in the chat, kind of what it means to you, and also what activities that you associate with green social prescribing. That'll be a really good snapshot for us to sort of work from. Next slide. So going back to our sort of starting point, we already know there's some absolutely fantastic things going on, and we've had the pleasure of speaking to a lot of you over the last few weeks. So again, this is just a very small snapshot of what we've already got in the area. So we have Yorkshire Bike Bells, who are using cycling to access green space in York, Raincliffe Wood Community Enterprise, who are now running weekly woodland wellbeing walks, Navigo, using Grimsby Garden Centre for horticultural therapy. Next slide. And then sort of, groundwork Yorkshire in Hull, working with the community to clean up their green space. Volunteers making our green spaces accessible, so repairing public rights of way in Raincliffe, and then dedicated ecotherapy services such as that at St Nick's in York. So using a variety of different activities, including arts and culture through storytelling and things like that. So we've got a really good foundation on which to start and build from. Next slide. We've also got well-established and different social prescribing networks in each of our 6 places, which encompass the VCSE sector, mental health provider, and public health invested approaches. So, really good place to do that learning from. And we're partnering with social prescribing leads from across the region to establish a working group so we can better connect social prescribers and green providers. Next slide. So in terms of what have we been doing, myself and Hannah, as I said, we're 9 weeks in, so there's been a lot of networking. So we've been speaking to our mental health providers, social prescribing leads, existing green social prescribing providers, linking with networks such as our local nature partnerships, universities, and also our active partners. As Brent says, the steering group is there. We held our first meeting on the 18th of May, and we've got our next one on the 22nd of June. We're starting to build a database of green providers across the region. So 260 initiatives I've identified so far, from local walking groups through to regional and national charities that are running activities. I've spoken to 17 of you, had some really, really good conversations, and there's more in the diary. We have been sort of establishing our working relationships with our national partners as well. So, we're one of 7 programmes across England, and there is a national team. So we've linked in with the NHS, Department for the Environment, Fisheries and Rural Affairs, and Natural England. And there's also a national evaluations team. So we've been building those relationships. A lot of the work that we've been doing recently is working on our monitoring and evaluation framework. So looking at what we want to monitor, how we're going to do it, but also looking at what we're doing locally in respect of this national programme as well. We've been engaging with active organisations, so looking beyond the sort of traditional green social prescribing activities and seeing what else is out there. And we've been lucky enough to align the programme with some funding already. So the NHS Charities Together have a £200,000 pot of money for green social prescribing initiatives, and I'll post the details of that in the chat a bit later. We've also issued our first newsletter, so that's the first of sort of monthly communications to let you guys know what we're doing and how the program's progressing. Next slide. So moving forward, we're looking to work in sort of 3 phases. So this first phase up until the end of this year is very much kind of profiling and investing. So working with our social prescribers, mental health providers and green providers to profile what's going on, what's going on, where is it going on, who is benefiting from green social prescribing, what are the barriers and things like that. And we'll also be able to release some funds through the programme to the VCSE sector. Phase 2, so from sort of autumn, winter this year throughout 2022, we'll be looking at our designated cohort, which Hannah will go into more detail about. But basically, following people through a journey from when they make contact with the services through their green social prescribing intervention. And then phase 3 is very much kind of summing it all up. So bringing that data, all those networks that we've made, and building confidence in green social prescribing with the view of further investment from 2023 onwards. So I'm going to pass over to Hannah now.
Thank you very much. Could I have the next slide, please, Sarah? So good afternoon, everybody. My name's Hannah Armitt. I'm the clinical lead for the Green Social Prescribing Programme, and I started at the start of April with Anthony. So I work 2 days for the programme, and then the other 3 days I work as a clinical psychologist into Humber NHS, into the research department. So next slide, please. I'm just going to give you a bit of an overview of the research and evaluation side of the programme. So what we know is that green social prescribing is highly effective, and there's lots and lots of studies that evidence that nature has significant health and wellbeing benefits. So for example, I think it's been found that even 5 minutes of spending time outdoors a day has significant benefits for your wellbeing. There's lots and lots of research out there about individual projects, and kind of the effects of spending time in physical exercise. But what we don't really know is, as it says at the bottom there, what works for who, in what circumstances, and why. So we don't really know much about the detail of what it is that the natural environment gives us that improves our well-being. So we know that green social prescribing has been around for a long, long time, and particularly in New Zealand, it's kind of been embedded into their healthcare system for about 20 odd years. And the majority of the focus there has been on physical health. So studies looking at what kind of physical health interventions benefit your, kind of mental well-being, physical well-being. But we know that the research evidence base is significantly behind practice generally, particularly in the UK. We know that green social prescribing and social prescribing is being recommended as an intervention, but actually we need some good quality evidence that shows why it works, and so that we can start investing more money in it, essentially. So we've got a great opportunity as a test and learn site to start providing some of that evidence, to start looking at what is happening, what the effects of that are, and kind of why people think it's working. So next slide, please. So as Anthony mentioned, we've got our local evaluation plan to kind of start gathering some of this evidence, and that fits in with the national evaluation that's going on. So the tender went out for the national evaluation, and it was won by Sheffield Hallam, University of Sheffield, and the University of Exeter. So they're the 3 universities that across the whole country are going to be looking at the 7 sites and kind of providing that national evaluation, gathering all the data, analysing it, and producing the reports. And the national evaluation, their focus is on preventing and tackling mental ill health. So it's kind of moving a little bit away from the kind of physical health benefits that we know are there, and actually looking at what can green social prescribing interventions do for mental health. So the universities are working very closely with us. We've had a couple of initial meetings. And what they want to do is really think about what's the best way to evaluate. So they don't want to kind of come in and kind of put different, things in place that aren't going to fit with our services. So our initial kind of focus has been on meeting with them, finding out what they would like, and then kind of seeing how best our providers can give that to them. And they want to collect qualitative and quantitative data across 7 stages. So we're kind of in the very early scoping stage at the moment, just kind of gathering information, what's already happening, and then what can we do next. Next slide, please. So as I mentioned, the kind of key questions are what is working for who, in what circumstances, and why. So we want to know how many people are benefiting from green social prescribing in our region. Who are they? what activities are they engaging in? And as I can see from the chat, there's a whole range of interventions that we're interested in. So it isn't just the kind of active physical interventions, it's gardening groups, forest walks, all kinds of things. And then we want to know, what do the outcomes indicate in regards to how effective green social prescribing is? And I'm going to talk a little bit more about outcome measurement in a minute. And ultimately, I guess we want to know, does green social prescribing lead to positive increases in mental health and well-being? And how can we measure that? And then the other side is, at a systems level, what is the best way to deliver green social prescribing? How can we learn from all the excellent work that's already happening and find examples of good practice, learn about what people are maybe finding difficult, how they overcame those challenges, and then how can we kind of share that best practice across the 7 places? So next slide, please. So I've mentioned a little bit about outcome measures. So we've obviously got various ways that we can collect data, information about, you know, how our activity is working for us. And I guess one of the most kind of rich ways we can do this is through case study reports. So going and speaking to people, asking them, you know, how they experienced an activity, and just kind of recording those experiences. So that's definitely something as part of the national evaluation, and locally we're looking to do, is gather some really great case studies to evidence, you know, how things improve for people. And we've got Tony, our patient representative on the steering group, and he's certainly someone who's provided, you know, a really rich case study in terms of how a green social prescribing intervention has benefited him. And I think those kind of examples can be really powerful. I guess the only problem is, as I've put there, we can't generalize. So although it's a really good example, we can't say, well, that could work for everybody. It might be very different. So there's a variety of outcome measures that we use currently in social prescribing services. For example, I've put a couple of them there, the ONS4, WEMWEBs, SHREMWEBs, and as you can see, they're kind of forms where you rate your mood. Some people find those maybe a little bit reductive, you know, kind of bringing these big concepts down just to a number. So there's also things like what matters to me, recovery star, which is a much more detailed, rich picture of what's going on for somebody, what intervention they engaged in, and kind of how they felt afterwards. So I guess I've kind of asked a question here, and it'd be really nice to know what people think of these kind of different measures. I'm sure we've all filled in questionnaires, you know, tick box type things when you've been to the GP. And I guess one of the things that's already emerging is that people are saying they're not necessarily happy with some of these measures, that although they are the kind of gold standard that we use in some of these services, they're perhaps not capturing this rich data that we'd like to see. So we've put there as well the Mood Beam device, which is a device that has been developed in Hull, and it's a kind of wearable band that kind of helps you in real time log your mood, sleep, that kind of thing. So we're also trying to be a little bit creative in terms of how we measure outcomes from green social prescribing, so that we just get a really rich picture. Next slide, please. So as well as the kind of the national evaluation, the local evaluation that's going on, there's also, obviously, we've got some brilliant universities in the area who are also really keen to be involved. So we've got the University of Hull have got some grant funding, which is connected with Team GB. And myself and Anthony are working closely with that team to think about how we can benefit from the work they're doing and how they can benefit from the work we're doing, so there isn't kind of too much replication. And then also the University of York, obviously, they've got quite a few projects in this area, and also there's a test and learn site in South Yorkshire, so they're linking in with them as well. And I guess the message here is that we are all going to be working together to share learning and make sure that we're not replicating work. Next slide, please. So as Anthony said, the thing we are working on at the moment is putting together a proposal that we can take back to the steering group to just be really clear about kind of what we need to do in this phase one. And a lot of it's going to be around kind of gathering existing outcome practice and data. So we want to know what's happening at the moment, what kind of outcomes people are already gathering. Can we get some of these reports in to show, you know, actually green social prescribing is happening, it is working, and kind of start to learn from some of the good practice that's already happening. And also, like I said, building links and connections between groups. So as we're discussing, you know, we're asking some people, what outcomes are you collecting? And then we're going to different groups. And I think everyone's just interested in knowing how other people are working and what's working well. And like I've said, linking with the universities in the region on successful bids that have already happened, and also some upcoming bids that they're interested in putting in and having our involvement. Next slide, please. And then phase two, so Anthony mentioned, we're looking in phase two, which is kind of autumn, to follow a cohort of people. So that's a group of people with shared characteristics. So phase one is understanding what's already happening, and then phase two is about following this cohort of individuals through their green social prescribing pathway. So from points of kind of referral or coming into the service, looking at their journey, and then kind of measuring what's happening for them, you know, kind of getting some case studies and also some outcomes. So that's some of the initial work I've been doing, is defining who is that cohort of people that we're interested in following. And to do that, we've kind of met with mental health providers to have a think about what their priorities are, and kind of how easy it would be to follow this group of people. So on the next slide, I'll just kind of talk you through this initial cohort. Next slide, please. So with the cohort, what we're looking to do is follow a group of around 80 individuals in each of the 6 places. So kind of 40 at one time point and then at another time point. And we're looking initially at 18 to 65 years of age. And I think we've had a lot of questions about why 18 to 65. I guess firstly, we're focused on adults, not child and adolescents, although we'll certainly be kind of gathering some information about that from other sources. And we've kind of put the cut-off point at 65 years because that's when older adult services kind of generally begin. So we're looking at that kind of age range. This isn't to say that we aren't interested in hearing about other people's experiences. It's just with this cohort, we want to define a group of people that we can quite closely follow through, and this is the group we've picked. So those experiencing mild to moderate mental health issues, so anxiety, depression, low mood, low level of risk to themselves and others. And then exclusion criteria for this cohort around more complex risk, possibly additional needs such as significant substance misuse. And I guess this is just to acknowledge that some of our green providers, possibly, these are the cohorts of patients that might be more comfortable to work with. So individuals with more risk, we're going to have to think a little bit more closely about, you know, kind of how that all links together with the healthcare systems. As I've put there, we've had some really interesting discussions around supporting individuals within secondary mental health services, where there's a lot more higher complexity. And I guess just to emphasise that just because we've chose this cohort, it's not meaning that green social prescribing doesn't benefit others. It doesn't mean that we're not interested in gathering outcomes, for example, on older adults or children and adolescents. This is kind of just where we're starting in terms of measurements. So I think that's a summary of where we're at the moment in terms of evaluation and monitoring. And as I said, we'll be producing a proposal which will be discussed at the next steering group, just to kind of make sure those details are clear. So I'll pass you back to Anthony now.
Excellent, thanks, Hannah. If we can have the next slide. So yeah, in terms of getting involved, you know, we've spoken to a lot of you. We've had some absolutely amazing chats, and people have been so enthusiastic about the program. It's been brilliant. But yeah, going forward, in terms of sort of mental health providers, We would like to understand how green social prescribing currently fits into and links with your existing work streams. So I just saw a little bit in the chat there from Jackson. So yeah, we're trying to link into other programs. Yeah, looking at these barriers and enablers to green social prescribing. If there's any data out there that showcases green social prescribing and its impact, and really start to look at what needs to occur at a system and place level to embed green social prescribing. Next slide. So social prescribers, we're looking to better understand how green social prescribing is currently linked with your existing work, what needs to happen to form those better links between green providers and social prescribing networks, capture current best practice, as Hannah said, and showcase what works well. In some of our conversations over the last week or so, we're kind of learning that there are new initiatives coming up and being formed as we speak. So it'll be really good to sort of document those from the beginning and watch those initiatives evolve. And again, you know, for ourselves locally and also for the national team, we're wanting to look at data to answer how many people are benefiting in our places, who is it that's benefiting from green social prescribing, what activities is it that they're engaging in, and what outcomes are being measured. Next slide. And in terms of the voluntary community and social enterprise sector, we want to understand from you guys how green social prescribing is currently working. So what are your referral routes? How are people finding out about you? What barriers and enablers are there to accessing healthcare systems? Kind of what capacities do you have in terms of referrals? What training and support needs might you have to enhance your offer or better link with healthcare services? And as Hannah mentioned, gathering case studies. So, you know, capturing what's going on already through case studies, and what current monitoring and evaluation is being carried out, which is kind of, you know, showcasing the impact of the work that you're doing. As we move forward with this clinical cohort, we'd also be looking for organisations to support that work and be able to take referrals, which would be brilliant. And as I mentioned, the NHS Charities Together funding deadline is the 18th of June. So that money is out there for the VCSE sector to apply for. And Sarah's put the link in the chat. So I think that's everything from us. If we go on to the next slide. We've got some time for questions, sort of 10 minutes or so. So yeah, you can raise your hand or put your question in the chat and we can answer it. I think Victoria is going to have a look.
I imagine people are busy typing.
Yeah.
I think there's a couple of questions further up as well, Victoria.
Oh, I thought and you'd answered them as we were going along, so that's why I hadn't gone back.
Okay. Just about more intrusive, less intrusive methods of collecting data, which is a really good question. Which, yeah, I think we're very open to kind of less formal, more creative means. And I'm sure the national evaluation will be, you know, keen to hear that.
Okay, so we've got a question come through. It says, how are you getting your 80 volunteers to register? Do they have to be already engaged in some form of NHS therapy? So Anthony or Hannah, do one of you want to pick that one up?
Do you want to jump in, Hannah?
Yeah, so I've got to be honest, I think that's something we're still considering place by place where the cohorts are coming from. So I think it will primarily be focused on primary care settings, but I think that is something we need to think about in terms of defining that cohort. And I think it's whether each of the 6 places want to look at that differently in terms of the referral routes. So it won't necessarily be a volunteer for a study, it will be, you know, people that are using the services and then kind of asking if we can gather that data. But I think that's something we still need to iron out.
We've had another question come in, but it's not actually directed at us. It's directed at one of the participants. So I don't know if Sarah wants me to ask Sophie this one, but it was about explaining what the NHS mandated quality check entails. And she's explained a little bit about a code of practice that they have, and if that could help with and assure that NHS and reduce the need for the NHS check.
Hi, Sarah. I don't know whether Sophie just wants to come in, really, I think.
Yeah, I can do. So as part of the social prescribing DESN contract, we are only allowed to prescribe to organisations that complete a quality check interview. And we managed to split it into two sort of sections that the NHS have given us the template for. So for smaller groups, we have to see copies of a bank account if they have one. We have to see insurance, constitution. We have to talk to them about safeguarding, equality. Ideally, they have to have a safeguarding policy. For larger groups, we have to see about, I think it's about 10 different policies. And what we found is an awful lot of the smaller groups have just, well, not even very politely told us where to go. And that it's a real concern for us because it means we can't prescribe to them at all. And there's often things like kind of the ramblers who just said, no, we're not interested, community fridges. And it's very difficult to kind of find a way around it. If they won't fill in the paperwork and we won't do the interview, we have no choice, we can't prescribe to them. And it is quite also, I understand the need to quality check to some extent, but I also think we're taking away some individual responsibility here. And it feels a little bit like wanting to kind of control the next stage of where somebody goes to, whilst we wouldn't send anywhere to some people to somewhere that isn't safe or that we wouldn't consider safe. It does really limit us with small groups because they're just not willing to sit and do an hour's interview and give us a load of paperwork that they might not have. And if they don't have it, we can help them, provide them with templates, but in a lot of cases they don't want to, and I get their viewpoint, I guess. Does that make sense?
Yes, it does. And the reason I mention it is because, well, Rachel Fell-Chambers, who's one of the other attendees on the meeting, who is care farmer, but she's also one of our code of practice assessors. So on a sort of voluntary basis, she actually assesses the applications from other green care and care farms through our code of practice. And I think the process that we go through is that we provide support, we provide sort of online meetings that people can dip into, that can ask questions, get support. We provide lots of guidance notes around what constitutes evidence regarding different things. We refer them to policies, example policies, and we don't give everyone a list of templates, otherwise they'd all be identical, but we do provide quite a lot of support and guidance as part of that process that Social Farms and Gardens is already doing. Anthony's well aware of the process. I just wondered if there was any way of kind of working together to link the two and to show what goes into the code of practice, because it covers everything you mentioned there in terms of policies, procedures, safeguarding, governance, bank account details. You know, it's about every aspect, and I'm sure Rachel would probably echo that as well. And we'd certainly be keen to speak to you and your team, I guess, to see if there's any way that we can sort of, if the code of practice could become just a tick box so that the groups could work through with us, we could provide them with some support to get them through it. Then they could just say, right, we have the code of practice, and a bit like when people have SSIP accreditation, such as CHAS or whatever, you know, you can just tick a box on a tender document and you don't have to kind of upload all your documents and everything. It's kind of taken as read that you've been inspected, and it is a process that happens annually, as well as sort of, what's the word, not continuation, but there's kind of an annual sort of check-in, and with any policy changes, particularly around safeguarding and things. It's just something that I'd be interested to know if it's possible to sort of circumvent the need for you to be doing all of that, if we're already supporting groups to do that. It would
be interesting to explore, because I think one of the concerns that certainly I've been noticing is that I've been trying to do some of them to get a better idea of what the resistance is, and I think a lot of the smaller groups seem to think that by having to kind of go through this, that we're looking to use them as a specialist mental health support service, and that we're going to send people who might not be appropriate, or that they don't feel that they would be safe around or able to support. And I guess the formality of it somehow seems to I don't know if it just puts their back up or it unsettles them, but certainly, you know, a lot of local walking groups and cycling groups have just said, look, we're just a social group. We're not a health service. Why have we got to answer all these questions? And I do sympathise with that point of view.
Yeah, I see there is a difference, and obviously the interventions that we're supporting through that process are generally those working with people with a defined need in some sort of a nature-based intervention. So I can see why the more informal groups that are literally just facilitating access to open spaces might find that a bit off-putting, but I'm not sure. I'm certainly be willing to have a chat about it after this meeting if you wanted to get in touch.
We can link you up. So I'll just ask, that was a really interesting discussion. Thank you so much. So next question I've got is from Gail, and she says, in areas that have established social prescribing services as well as PCN link workers, so primary care network link workers, how will referrals be made and who to? Hannah or Anthony, want to pick that one up?
So yeah, we're looking to work with those existing networks. So yeah, kind of following on from the other conversation, it's about how we link the two together. So yeah, referrals made direct from social prescribers and link workers, but what needs to make that link if they aren't there already? So that'll be a big part of the sort of learning that we are doing.
Yeah, I think that's part of our proposal, isn't it, Anthony? That's we need to understand those pathways better, those referral routes. That's kind of part of our initial work, really, is thinking how that will link together, and if it is, what's going well, and all those kind of different learning points.
Okay, we've got 2 questions in the chat, so I'll just ask those ones maybe, and then we'll wrap up. So the first one is from John Saxton, who has said, you mentioned the University of Hull Team GB partnership. We have a funded PhD studentship who could contribute to reviewing the evidence and evaluating outcomes, etc. Involvement in Team GB could really raise the profile of some of the cohort studies you will be doing. In terms of personal appearances from Olympic athletes, etc., do you see this type of publicity having potential to add value to the project?
Absolutely. So unfortunately we missed you yesterday, John. But yeah, absolutely. And really to raise the profile, yeah, of Humber Coast and Vale in terms of the other test and learn sites. So yeah, absolutely. We had the meeting yesterday, and hopefully we'll catch up with you again sort of fairly soon. Just kind of moving on to Patrick's one just underneath that. We do have support from Natural England within the programme. So we actually have some officer support. So being able to map green space and nature reserves and things like that, we should be able to do through Natural England capacity. So it's definitely something that we want to.
I think that's all the questions that we've got in the chat box then. I'll hand back over.
Brilliant. So yeah, well, thank you to everyone for coming along. Thank you to Hannah, Gary and Brent for their contribution. And yeah, I can pass over to Brent now just for some closing words, and we'll have the next slide.
Well, thank you very much, and thanks to everyone who's spoken today, and I hope that's given you a good sense of where we're coming from, what we're about, how we want to work with people. I hope you've taken something out of this afternoon's presentations. We'll be definitely keen to hear from you, and through Anthony and the team, please do make contact if you've got any follow-up questions. I know that Victoria's been scouring the chat to try and identify questions that we haven't come to, and if we can, we'll add them to the frequently asked questions that Sarah's been putting together. But we'll leave it there. We'll just say thank you. Enjoy the rest of your day, what's left of it. And we look forward to seeing you all again soon. All the best.